Welcome to the latest webinar in the AVA webinar series entitled Global and Local Perspectives on Sexual and Gender-Based Violence Programming and Research. This session is interactive and it's with our partner CanWaCH, where they'll talk about the gaps and opportunities in sexual and gender-based violence related to programming, research, and funding. And they'll draw on examples from both the Canadian and international context. My name is Sarah Yursich. I'm your host for the day. My role is much more of a supporting one. But I'm here if you want to message me, if you have questions, if you need any support. Jason and I are both here to assist. I am the Associate Director of the Frida Center for Research on Violence Against Women and Children, housed at Simon Fraser University, and also an AVA Early Career Researcher, which is my role on this project. Our speaker for today is Jessica Ferne. She currently serves as Director Global Health Impact with CanWaCH. In this role, Jessica leads CanWaCH's strategic efforts to strengthen Canadian monitoring and evaluation processes, capacity, and collaborations in order to drive evidence-driven programming and decision-making, with the ultimate aim of improving the health and lives of women, children, and youth. Thank you for joining us today, Jessica, and I'll go ahead and hand over the floor to you.
Hi, Sarah. Hi, everyone. Thank you so much for having me and allowing me to join you today. Before we go too far, I will just acknowledge I'm on the tail end of a bit of a cold, so I may occasionally just take a drink or perhaps mute myself for a discreet cough. So my apologies in advance. I'm just going to go ahead and share my screen. Sarah, can you kind of give me a thumbs up if you can see it in full screen? Wonderful.
Oh no, we still see it on the browser view. But
Okay,
we can see the slides.
okay, is it full, like is it otherwise large enough? Are you seeing like
Yes.
my
Yes,
desktop or other
perfect. Thank
things?
you.
Okay. As long as you're not also having to look at my messy desktop or my notes or other things like that. All right, great. So we'll begin with sharing here the AVA land acknowledgement. Um, uh, it says on a national level, we encourage all Canadians and visitors to Canada to learn about the Indigenous peoples of the land on which they live, work, or visit, and become engaged allies together. We, as Canadians, in the spirit of truth and reconciliation, respect the self-determination of First Nations, Métis, and Inuit, and their rights and responsibilities in cultures, languages, and the pursuit of wellness. Then it goes on to share some of the specific acknowledgement of the land on which the AVA Health Research Training Platform and its team are located, and you can read that here. I also wanted to share CanWaCH's own territory acknowledgement. CanWaCH, which I'll talk about who we are and what we do in a bit more details just in a moment. But one thing about us is that our team is fully virtual. So our team resides all across this land from coast to coast to coast. I myself am located in what is known as Ottawa, the traditional unceded territory of the Algonquin peoples, but also many other Indigenous nations as well. I grew up here, I was born here, and moved away for a little bit, but have since returned. And a few years ago had my own daughter living here. So this land is home to me. And it is a really beautiful and important place. And I take my responsibilities in learning about that land very seriously, and also in sharing those learnings with my own daughter and for generations to come. So we're excited to be here with you and to be talking to you about this important subject. But I just want to acknowledge how grateful all of us at CanWaCH are wherever we are located. Let's dive right on in to today's conversation. And I'm gonna just start talking for a little bit and then leave lots of time at the end to kind of unpack some of these questions with you. However, if something doesn't quite make sense or you'd like to ask a question, please just take yourself off mute and ask it. You can also write it in the chat if you'd rather, but we're all friends here. So please just feel free to jump in at any time. And I recognize that a lot of what I'm going to share is going to come from a standpoint of kind of global or international perspectives. And so really hoping to learn from those of you who have more of a domestic a focused approach to your work about similarities and possible opportunities for collaboration. Today I'll hit through talking a little bit about where we're coming from, share a little bit of context, and I think my main takeaway from some of the context is going to be the similarities and the common threads between what happens around the world and what happens here in Canada, and then hopefully have lots of time for discussion on a few different kind of related points as well. But let's start with who we are as CanWaCH and who I am. So as Sarah mentioned, my name is Jessica Ferne. My pronouns are she, her. And I am the Director of Global Health Impact at CanWaCH, which means that I handle kind of all things relating to the measurement, monitoring, evaluation, and research, basically understanding the ways in which Canada has an impact on the health and rights of women, children, youth, and their communities in Canada and around the world. And I like to describe CanWaCH, or our full name, Canadian Partnership for Women and Children's Health, as a consortium or a collective of actors who work at the intersections of global health and gender equality. And that includes civil society organizations, organizations that you might know, like the Canadian Red Cross or World Vision Canada, or the different civil society actors. We also have academic institutions, so research hubs, universities and departments of health. We have private sector partners. We have health professional associations, midwives, Society of Obstetricians, Gynecologists of Canada, basically anybody who really works at that nexus in the broadest understanding of health and rights. And so much of this is with a global focus. So these are folks that are based in Canada or have a Canadian connection, but are ultimately working in service of improving the health and rights of women around the world. But we also have a domestic focus. Those partners do work here in Canada and are often engaged in reciprocal learning and training opportunities with folks globally. We do it through a bunch of different ways. We have a bunch of different pillars of work, but really central to what we do is being a convener, a platform, a space that brings folks together to achieve more than they would individually. And one of the ways that we are currently doing that, and this is how we became connected with AVA, and the work that you're doing, is through something called the Pan-Canadian Women's Health Coalition. So the Pan-Canadian Women's Health Coalition is supported by CIHR. It's an initiative of CIHR, and it is comprised of 10 different hubs located all across Canada. You can see kind of the institutions where the hubs are based on this little map, but in fact, the work is across all provinces and territories. And it is really heterogeneous, really interesting and diverse in the nature of the work that it does. But all of it is focused on important areas of women's health research and looking to move the dial and to mobilize knowledge about these issues in impactful, meaningful ways. So that's right up our alley. That's the sort of stuff that we love. And we're always excited when folks can come together to bridge those gaps that sometimes persist between kind of those research silos and the programmatic silos. And the role that we can play in connecting folks, in helping them to share their work out is really just the most exciting thing that we could do. So that's a bit about us and what we're coming to the table with. And so when I speak today about some of the things that we see, it comes from our experience and our work with well over 100 organizations working across the country, and what they share with us about what works, what their challenges are, and where the opportunities for kind of improved and further impact reside. I don't know too much about who's in the room right now, and so I'm going to assume, since you're here, that you have an interest and likely a background and knowledge about sexual and gender-based violence, certainly at a domestic level. And so I don't want to spend too much time on the realities that we all know. So what I'm going to do is just highlight a couple of quick points that are certainly true in this broader global context. And I think it's important to look at this and to compare it and to understand, or to view it through the lens of our own experiences domestically, because of course we can't overlook that there are very important, contextual nuances in each place where SGBV occurs. Um, Issues of violence, hatred, discrimination are prevalent all over the world. So this statistic that globally 1 in 3 women experience physical and or sexual violence in their lifetime is a well-known and well frequently shared statistic. And I think it's also important to underscore that this does not include estimates of harassment, which would bring this number up significantly. Um, and globally, it's really hard to kind of paint with broad brushes because of how varied SGBV is, but we do know some things. We do know that over a quarter of women over 15 years old experience intimate partner violence. We know that more than 5 women or girls are killed every hour by somebody in their own family. And we also know that SGBV occurs everywhere, both in places that are, politically and economically stable, but also in fragile or unstable contexts. And the challenge, of course, is that in disasters or in humanitarian contexts, what we can see is both an increase of risk, but also the potential creation of new risks as people's dynamics and lives and livelihoods are completely changed. So you're as a woman, your risk of experiencing sexual and gender-based violence rises from over 33% to 70%, an almost certainty that you will experience sexual and gender-based violence in that context. And these are broad figures about women. And I want to acknowledge that I'm using the term women in all of its diversity, and women's experiences in all of their diversity. But we also know that globally there are massive gaps in what we know about the experiences of a diversity of individuals. In particular, adolescents and young women, migrants and people who are here without status, 2S LGBTQI communities, racialized women, people of color, Indigenous women, so on and so forth. we also know that and this is certainly not an exhaustive list by any means. We also know that, an intersectional lens makes it very clear that many of these individuals are also at risk for other types of violence and abuse. For example, people living with disabilities or older people may be abused by those who assist them, manage their finances, may be at increased risk of being isolated. Those that are without status, refugees or internally displaced people, sex workers, people experiencing incarceration, anybody who is with limited legal status or means has few options to pursue and may not want to, address or be able to respond to the violence that they're experiencing. So we know this. We know this from common sense and from some of the research that exists. But the nuances of the experiences of these individuals within communities is often quite limited. Um, the other thing, of course, is that SGBV is not static. What it looks like, where it happens, how it happens, that's continuously evolving. As we try to understand and respond to what SGBV looks like, we have to be prepared to respond to the changing kind of landscape and the changing face of it. A handful of examples would include the climate crisis, and combined and aligned with this, kind of the increase of what we call polycrises around the world. So compounding crises occurring in one context. We know that that climate change is rapidly changing contexts from relatively stable to crisis contexts, sometimes very quickly, and makes resources that maybe were accessible, were available, or were well known suddenly disappear. Technology facilitated SGBV is something we're talking about increasingly in global contexts. It's something that has been talked about in so-called developed contexts, for a long time. But of course, more and more people around the world have access to mobile devices and technology. And the rise or the increased proliferation of technology, different types of technology, is rapidly changing not just how prevalent technology facilitated SGBV is, but what it looks like and how to be on the lookout for it, how to identify it, how to respond to it. We've made globally some incredible strides when it comes to certain elements of life for women. This looks like increased presence of women in public life. More and more women are assuming roles in political office. More and more women are visible as journalists and media personalities. More and more women own property, have wealth, have access to education. But these things change the context. When women's roles change, the risks change. We know, for example, that when it comes to technology facilitated SGBV, I think it's less than 50% of women live in places where they're protected by law from online harassment. 82% of women in parliamentary roles experience psychological violence during their term. Uh, we know that women journalists in particular are the ones that are most likely to report issues of SGBV. And we'll talk a bit more. I have an example at the end about kind of language and media and working with media. But we also know that women journalists are at an increased risk of being targeted with violence, particularly when they report on issues relating to gender, politics, elections, human rights, and social policy. The more they have access to land, the more they have access to resources, the different strategies get implemented to try to control those resources or take them away. So this is something that requires kind of constant adaptation, reinvention, and a re-understanding of what violence looks like, how it manifests, how it's experienced by women and girls and around the world. So I want to speak super quickly to this idea of how SGBV has evolved over time from being thought of perhaps as more of a private issue into more of a public one, and then speak a little bit about what this means for how Canada shows up in response to SGBV. So I think over much of history, we've seen the language around SGBV, but also kind of the responsibility for SGBV kind of shift and belong to many different domains, whether that's conceiving of violence as a legal matter or a criminal justice issue, seeing it as a private matter, a family matter, or a matter of ethics, a matter of belief. Um, that that was for a long time kind of where SGBV was relegated. Then we started to see a bit more of a shift towards rights-based language. And then more recently, this framing of violence and sexual and gender-based violence as a public health issue has arguably helped to broaden responses and increase buy-in from a range of stakeholders who now perhaps see violence as being or addressing SGBV as being kind of in their interest. Um, and this extends to both the what we call the acute and the chronic impacts of health, and using that language to talk about SGBV. So acute being things like injury and pregnancy and all the complications that can respond to that, infections, all the way through to ongoing, long-lasting issues such as chronic pain, post-traumatic stress disorder, and trauma. Links to harmful behaviors, etc. And then also with this widening understanding of this as a health issue is a broadening of the issue to understanding those physical and mental, but also the psychosocial and economic impacts as well. Quick pause. Excuse me. Um, the other thing that a health perspective does is shift the rhetoric around SGBV from being something that's a moment in time. And something that's happening in kind of a discrete way, and instead understands the full way in which an event or an experience can shape one's whole life, and also the ways in which SGBV can show up throughout the course of the life cycle. And that means that, those ramifications are not just the immediate ramifications, but the long-term and long-lasting one. This little image down here in the corner is from a field guide that I'm going to talk about in a little bit. But specifically, it's about responding to sexual and gender-based violence in humanitarian contexts. And this kind of framing of looking at the course of the lifetime and all the different ways in which we might see violence manifest is very much a product of linking it into health responses and its long-term impacts. So with all that said, and with all that kind of context, I want to take a step back and reflect a little bit on how Canada has historically addressed women's health, and where we stand today. And I'm not sure how many of you are kind of familiar with this, so I'm going to give the quickest, roughest history lesson around funding commitments to women's health. And we're going to go all the way back to 2010. And it's not as though that was the first time that anybody had ever talked about women's health. But under Prime Minister Harper, we had a commitment made that was called the Muskoka Initiative, or what now gets called Muskoka One. This was announced at the G8 summit that was held in the Muskokas. And this was right at the time that the Millennium Development Goals were wrapping up. We were, conceiving of the Sustainable Development Goals as the next phase. And this was a commitment of $2.85 billion specifically to maternal, newborn, and child health. And that was the language that was used. This was then topped up 5 years later with Muskoka 2. This was an additional $3.5 billion to build on those investments. But again, maternal, newborn, and child health. So the focus was very much on moms and babies, and quite specific initiatives that would fall under that umbrella. In around this time, so around 2016, right, we have the arrival of the Trudeau government, and with them came a few big changes. And I'll talk about one of those, which is a policy change, in just a second. But one of the other things that they brought about was a change in how we talked about our investment. So this is where we saw a shift from the language of maternal, newborn, and child health to recognizing and highlighting that there was many important elements of women's health that were being left off the table or that couldn't be included or supported as long as we had this very limited definition of a window of time. So there was something called the Her Voice, Her Choice commitment, which came in at the tail end of Muskoka 2 and threw in a little bit of extra money, a little bit, 650 million, to support sexual and reproductive health and rights. Then in 2019 at Women Deliver, which is a massive, which is an entity but has a massive international conference. It was hosted in Vancouver. And there, the government announced what sometimes gets called the Thrive Commitment, otherwise gets called the 10-year commitment to global health and rights. And this was a $14 billion commitment made over a 10-year period. So this was quite historic in both the dollar value, but also in the longevity, because as you can kind of see, even in the short timeline, small project-based funding of 3 years, 5 years is kind of the norm within the global development context, and I believe with funders in many places. And so having this longer term time horizon to achieve goals and objectives was really exciting. The And to be clear, this is all for programming as opposed to let's say research, which is done separately. Within this $14 billion commitment, there was money that was ring-fenced, $700 million that was ring-fenced to what gets called the neglected areas of sexual and reproductive health and rights. So these are going above and beyond sexual and reproductive health and rights. Generally, these are 5 areas that are understood to be the least likely to be funded for a variety of reasons. And sexual and gender-based violence is one of those 5. More on that in a second. So, introduced in 2017, Canada developed its Feminist International Assistance Policy. So right before this big commitment to funding, we had the FIAP, because we love our acronyms. This was, the choice to use an explicit feminist language was unique in Canada, and put a variety of targets and measurements specifically around the integration of gender equality, requiring that the majority of the work that Canada does globally has to be connected to promoting equality and empowering women and girls. Um, there's a variety of different action areas. And you'll notice, well, first of all, health is called out under the area of human dignity. But down under peace and security, there's an explicit reference to gender-based violence. So even in these broad key action areas, Canada called out a commitment to addressing gender-based violence globally. And with this came a variety of indicators. These are some of the key performance indicators that are tied to the FIAP. And I share them solely to illustrate that there is explicit language, explicit measurements and targets that Canada is responsible for reporting on that name and call out sexual and gender-based violence, sexual exploitation, and a variety of intimate partner violence and a variety of other issues. So these are it's very specific and named language and a priority area for Canada. So, for the last few years, Canada has published reports on this 10-year commitment. We expect another one to be coming out in the next month or so, or the next few months. But this is the most recent the most recent report. So remember I said that there was a ring-fenced 700 million for SGBV under Canada's commitment. So you can see here, there's been a steady increase between the 2020-2021 period and the 21-22 period, an increase overall of about 22% in investments to SRHR, with a combined total investment value of 208.2 million. As of today, right now, there are 223 global affairs funded initiatives that are specifically coded as being about eliminating violence against women and girls. And as you can see, these are those 5 areas that I mentioned that are considered to be neglected areas: advocacy for SRHR, comprehensive education, safe abortion services and post-abortion care, family planning, and responding to SGBV. And SGBV is the most, and appears to be, at least over this 2-year period, or this, 2-year period, the most well-funded within these neglected areas. So, given all this, what are some of the challenges and the realities that we face when it comes to implementing SGBV programs? So I've shared here, some of you may be familiar with the WHO framework. It talks about, it's usually called the 3AQ, although there's been the recent addition of another A, so 4AQ. These A's are availability, acceptability, accessibility, and quality. This little diagram on this side from UNICEF is a modified version of that framework that was developed specifically for their work around responding to sexual and gender-based violence experienced by children. Analyses by UNICEF, by many others, really underscore that there is a profound and persistent lack of comprehensive, integrated, women and girl-centered approaches, and that we tend to fall short in one or more of these areas, which fundamentally renders the programs and services that we aim to offer far less effective than they could be. We know that effective SGBV programming requires coordination from multiple sectors, right? Not just health, but social services, sometimes legal services, economic services. And so when there is a lack of coordination or collaboration, you end up with very fragmented services, and that means that those that have experienced or are living with violence may receive incomplete or inconsistent care, one over our responses one over the other. Um, Also, we recognize that when you've got that many different stakeholders and that many different individuals, and also that many different points of entry into services when women and girls try to access them, you can end up, encountering just the different priorities, different level of training and knowledge, awareness of what SGBV looks like, how to respond, what services are truly out there. We can have the staff or the individuals that women connect with may lack training on trauma-informed care, on cultural sensitivity, on how to respond. And this, of course, can be highly re-traumatizing for the very people who are seeking to access these services. Oh, that is the link to I always click on it. I don't know why. There you go. I wanted to share this quote. I assume you can still see my screen and that I haven't accidentally moved you over to the UNICEF framework. Please tell me if I have. But this quote is from the Wiyani First Nations Women's Safety Policy Forum that was held in Australia with First Nations communities in Australia. But it's a fascinating report that I recommend reading. But one of the reasons I share this particular quote from that forum is just also to underscore that one of the other significant challenges, of course, that we face in designing and implementing effective programming is that the ways in which we understand what violence looks like, what the responses should be, are largely based on Western approaches and colonial legacies and past and present. And so too is true of much of what is called international development and global cooperation. A lot of the programs as they are designed, a lot of the resources as they are designed, often focus on things like criminalizing perpetrators, and that may or may not align with the values and perceptions and understandings of communities. Even more broadly than the individual challenges of implementation, we see this overarching kind of framework or conceptualization of what violence is and what the right response is to SGBV, and that may come from a place that isn't necessarily relevant or appropriate or accessible to the folks that we work with. I also wanted to speak to this because it's something I'm very passionate about, of course, and this is the issue of how you fund SGBV programming and responses. So, as I talked about when we talked about kind of that funding model, the project-based funding or program-based funding that tends to go on short cycles, and this is something I'm sure anybody here who's ever received any sort of public grant can empathize with. Durations are short. Oftentimes, the focus is on what's new, what's innovative, and not on sustaining things that worked. I mean, I've heard in many contexts, both domestic and global, Canada referred to as the land of pilot projects, where initiatives maybe get off the ground, get some seed funding, start to do some really interesting work, and then promptly cannot be funded again. That work then disappears. Those relationships disappear, though the accountability disappears, only to be recreated and again at a future moment, maybe under a different heading or under a different context. And that does real damage to relationships with communities. It also means that we're often operating under very tight timelines. And when you're looking at an issue like sexual and gender-based violence, something that touches on, making inroads on this touches on real issues of, systemic, cultural shifts and changes. Um, it's very hard, to put it mildly, to make massive cultural shifts in a 5-year project cycle. That's just not how people work. That's not how, societies change. And so the idea of trying to address a massive, complex social question in a project-based manner, with project-based funding is, I think, really an impossible feat. And then coupled with this is the fact that the money that is available is usually targeted for immediate response. And again, that conceptualization of what response should look like, as opposed to prevention or and or healing for people who have experienced with lived and living experience. Some of you, if you've ever worked in the international space, you're familiar perhaps with something called CG002. This is a guideline produced by Canada Revenue Agency, and it is the guideline for organizations that are working, Canadian organizations working with international organizations abroad to achieve what are called charitable activities. And I mention this because, as we'll talk about in a second, one of the strategies that's often highlighted as an important one for addressing SGBV and many issues, of course, is to work directly with communities, particularly local women-led grassroots groups from communities. And so, sometimes the question goes, well, why don't we do more of that? And in fact, one of the reasons that so many Canadian organizations struggle to do that is because under this guidance from the Canada Revenue Agency, uh, all Canadian organizations who receive public money have to be able to demonstrate that they have what is called direction and control over all project activities, basically meaning that they have the ultimate authority to stop or start any activity. And that's seen as being one of the ways in which we demonstrate, fiduciary responsibility and control against corruption and the misuse of funds. This is something that is widely, I feel comfortable saying widely contested. There's been a bill brought forward in the Senate to try to change and address this, but it really creates a fundamental tension to and sets up a hierarchy of relationships, which make it really difficult to get money to grassroots groups. And I know even within the Canadian context, right? Smaller organizations, informal groups that are often the ones most trusted and with the best knowledge in the community, for a variety of reasons, cannot access the dollars that they need, and then end up in partner relationships with other institutions who may or may not share their values, their approaches, or their priorities. And then again, this larger question of, when it's everyone's responsibility, it's no one's responsibility. When issues around violence can live across multiple departments, whether it be health, whether it be law enforcement and legal, whether it be economic, whether it be, something specific for women and gender equality, the question becomes, well, whose responsibility is it to fund this work? Where does it live? How do we track it? How do we track the dollars that go out and that are spent? I will say that I think under the approach that Canada is taking. Canada's developed some specific codes for how we track the neglected areas of sexual and reproductive health and rights in our funding. And I think that that's a really important step because when work in SGBV gets kind of bundled up under the larger heading of health or violence or peacekeeping, it becomes really difficult to parse and to find out how much of that is actually going to address specific sexual and gender-based violence, and not get lost in a larger shuffle of other types of initiatives that aren't what we mean when we say we need to address SGBV. So that kind of ambiguity is really challenging and can make it difficult if you're looking, let's say, at other donor governments around the world or other funders to try to understand what exactly is available and if what's going out the door is matching with the commitments that have been made. So I mentioned that my role at CanWaCH is focused on all things relating to impact measurement, research, and evaluation. I have to just talk a little bit about data and what we have and what we don't have. So I mean, and this is by no means oh, whoops, I lost you out there. It's by no means exhaustive, but we know that there is a real lack of qualitative data available that reflects the lived experiences of people experiencing and living with violence. Limited disaggregated data and monitoring systems that capture the nuance of SGBV. So a lot of the data that exists are the ways that we collect data around SGBV is around surveys, so sample surveys, et cetera, are often used, or maybe administrative data. But some of these official statistics can be compiled by national statistics offices and are based on these. But the problem is that only provides a very limited understanding or a limited picture of what is available. I think, do I have here? Yeah, I do. So there's this little graphic that kind of just highlights this from a fascinating report that I was reading around kind of the availability of statistics on violence. And so in many contexts, we might have a little bit of official statistics, which we can then supplement by, let's say, administrative data, and then, what gets reported by police or health or social services. And then sometimes through work that's maybe done in research or with communities, we have what might get disclosed about violence, but there's still that a gray zone of what is actually happening. And the reality is, I mean, we're only capturing a fraction of the actual prevalence and incidence of violence. Not all forms of violence or SGBV have robust data sources. Some forms of violence are perhaps less common. They occur with against specific populations or demographics that don't get captured in most data sources. Very obvious example being, the violence experienced by trans women, which may not show up as, a statistically significant population in a larger data set. Added to this, of course, are the challenges around protecting the privacy and of those who share the data, bias, stigma in the experience of not wanting to report, and the experience of reporting, limited training of enumerators and those doing data and research, different understandings around what SGBV is, what its definitions are, and then with different definitions means it's very hard to aggregate this data in any sort of meaningful way. Um, and you mean something else that I think about often is at the same time as we have massive data gaps, we know that we need data, but we also know that it is possible for research and evaluation to be instrumentalized to delay the implementation of things that we know work, right? Like why in some cases do we need data? Um, especially because of this, kind of land of pilot projects, we have communities that have been over researched, that have been sampled time and time again, asked the same questions again and again, asked to share their experiences over and over, without necessarily seeing that translate into meaningful or impactful change. We have, any of you who are in academic settings, have worked with research ethics boards, almost certainly. However, within the and many countries have, requirements to work with local research ethics. However, the reality is that international organizations can get around that. It isn't always clear. People are not always aware of the laws in the countries where they operate. Some countries have laws around not taking the data out of the country, for example. But organizations kind of coming in, working with different actors, it may not always be easy to track when they are or are not managing their data in a safe and ethical way. We have done some work at CanWaCH, specifically to strengthen the capacity of actors around ethics in evaluation and in research in global contexts. But there's definitely some significant gaps and opportunities for harm. And making sure that we are really clear about kind of that safety keeping and uh, making sure that we're taking care of the communities with whom we work and respecting their sovereignty and their ownership of data. That's something. There's been some fascinating and important work led by Indigenous nations in Canada and in other areas as well around these issues of data ownership, data sovereignty, and governance, and requiring much more uh, rigor and responsibility from those who wish to work with them in measuring and tracking how violence is experienced, how it's defined, etc. And all of this, I think, should prompt those of us who work in evaluation and research to be asking ourselves about, when do we need more information? When is there, how do we balance that tension of needing to know more, needing to be context specific, needing to really understand the unique needs, the definitions, the experiences, and at the same time not over extracting and not using evaluation or research and letting it be used as an excuse to say, oh, we just need to know more, we don't know enough. Because there are contexts in our cases where we do know enough about what works. Communities are very clear about what they need and want, and they want to see action, and not necessarily more research or evaluation. So, what do we do then? And what are some of those potential responses? So, I've kind of tried to touch on this as I've spoken a little bit, but of course, we have to continue to push for more multi-sectoral collaborations, and not just within health, but also looking at, media and other institutions that need to be kind of brought into an understanding of what SGBV is, what the impacts are, and how they can be part of a more supportive ecosystem. Working with diverse providers, frontline workers, both formal and informal. And I'll go back to that point around grassroots groups in a second. Um, Making sure that we're integrating technology, strengthening our communications approaches, and really allowing communities to define both the problems and the solutions. And it's all well and good to say that we want to work with grassroots organizations and actors. But hopefully, that's not going to work unless we change how funding mechanisms operate, what the requirements are to receive funding, the trust. Operating from a place of trust, as opposed to skepticism, within the context of financial due diligence, and all of these things in order to get money into the hands of women and communities experiencing this. From a research and data side, again, this looks like ensuring ownership, recognizing communities as co-researchers and compensating them accordingly, using more qualitative methodologies to capture the nuances and the complexities of experiences. Something we're really passionate about at CanWaCH, and we have a few different initiatives, and the Pan-Canadian Coalition is similar in that it's requiring partnerships and collaborations between academia, NGOs, local communities, to try to get at the fact that these different groups are incentivized in different ways, but that there are opportunities to come together to actually make changes that are most relevant and useful to communities. And then also, I think, which is important, is to think about the use of secondary data and research. Where is there existing information, existing statistics that may, be good enough? How can we work with donors to accept some of the secondary data, especially when we've, had it vetted and analyzed with communities to say this is where we're confident, and if we're going to spend additional dollars in research and evaluation, let's spend it really where we need more additional information, and focus in those priority areas as well. So very quickly, I'm going to just kind of share with you a couple of interesting things that we've been a part of, interesting initiatives that you might want to learn a little bit more about, and then I will stop talking, and we can chat a little bit more about your experiences, or anything else you'd like to know about. Um, but one initiative that some of you might be aware of is this one. It's called Communicating Equality. CanWaCH was a community partner on this initiative. This is an initiative that's specifically about promoting gender transformative messages, engaging with journalists, violence prevention organizations, men's groups, and really trying to think about the language that we use when it comes to talking about violence against women and girls, and using a kind of gender transformative approach to communications methods. So this is a strategy I think is a really interesting one. This is domestic, this is Canadian focused. But some of the content, some of the resources that were provided in this initiative are very cool to look at. And also just the concept of how you build and understand this messaging, and then providing these resources to community groups to think about uh, trying to create some cohesive, clear language that can be effective in working with different stakeholders. So this is the website if you ever want to check it out. It's a really interesting initiative. I alluded to kind of earlier on the humanitarian side of things, so on the disaster response. One initiative, yeah, we looked at those neglected areas of sexual and reproductive health and rights. One really interesting initiative that's come about is the creation of something called the MISP, the Minimum Initial Service Package for Sexual and Reproductive Health. So this is, and this is a snapshot of it, but it's basically a documented pathway that talks about what is it that we need to have in place around sexual and reproductive health services during a crisis or during a humanitarian context. This is the minimum. This is what you absolutely must do. And what you'll see, of course, is that prevention of sexual violence and responding to the needs of survivors is one of the called out objectives there, which has been really great to see that greater integration. And it's also been called out with detail in the manual that exists that accompanies this work. This was done by a group called IWAG, the Interagency Working Group on Reproductive Health in Crises. They are soon going to be housed within CanWaCH, so we're really excited to be working even more closely with them and looking at kind of the approach that they take, which is really rooted in having a survivor-centered approach, a rights-based approach, a community-based approach, and a systems-level analysis. So you can learn a little bit more about that. This is the link to this particular manual and some of the details around where the MISP fits into their broader work. And then this, I could give so many examples of amazing initiatives, but I talked at the beginning about some of the work that Canada has invested in when it comes to uh, SGBV. And I'm not promoting any one actor or any one organization, but this is a really cool group. So ADRA is an international development organization. They have something called the Together Project, which specifically looks at doing gender risk assessments using a variety of different data sources. And they use an explicit initiative called Community-Led Monitoring, Evaluation, Accountability, and Learning, or COMEAL. So this is really about community-driven approaches to understanding and designing responses. And they've done this across multiple countries, Kenya, Uganda, the Philippines, and Cambodia. You can learn more at ADRA's website, and also they've got lots of really great content around the use of COMEAL and how COMEAL can be effective in a variety of different contexts, but in particular in responding to SGBV. So I have a few kind of larger, broader questions that are kind of the complex questions on my mind that these things bring to light. But what I'm going to do is I'm going to stop talking and leave it to see if there's anything that folks would like to ask about or talk about. And the last thing I'll do is share, this is my email. If you have any questions or ever want to talk a little bit more about any of these things, that's where you can reach me. So let me pause there, Sarah, and turn it back over to you.
Wonderful. Thank you so much. Such an informative and thoughtful presentation. And I enjoyed learning a lot more about what CanWaCH does. So does anyone have any questions they'd like to ask Jessica? I know there's a lot to kind of make sense of and ponder. I was wondering, Jessica, I do have a question for you. Is around, I know that you're kind of a nationwide group and you also have that international element or scope as well. In your presentation, you talked about the need for like local and individualized contexts. Is it a challenge that you run into in your work or that your organization runs into, being really aware of smaller local contexts when you do your work across the nation?
I mean, I think absolutely being able to you know the world is vast and within that are so many unique individual experiences and the concept of public health, right, is responding to a public, right? It is making choices. And so that's why I think it's important to recognize that, no single intervention, no single research project, no single activity is going to be the silver bullet that fundamentally shifts and changes all of society. So it's not about the one thing or the one approach. I think rather it's, this constant iterative mindset that says, where what's working well? Where are there gaps? What's working well? Where are there gaps? But not taking things away to then add in new things. And that's where I think some of that kind of this larger angst and question that entities have around funding is really challenging, right? Because there's amazing initiatives, amazing work done by communities that needs to be sustained while other things come together in order, as opposed to, okay, we've done this for a while, now we've solved it. Now all the leaders in this community know that violence is bad, so we can just leave and, move to another community, as if that's the only reason violence exists and as if that's the only strategy, right? So, and that's again why I think, we broadly speaking, we need to really rethink how we fund programming and research, and how we measure impact. But also, recognizing that it's only through kind of these multi-layered responses and initiatives sustained over a longer period of time that we're going to be able to address the needs of those who are most frequently not able to access the programs that are there right now.
Absolutely. So well put. I do see a few things in the chat. Kate is hoping if you could put back up your slide of the questions that you posed. And there's also a question from Zara that's, I'm not sure if this was mentioned earlier, but how do we take into consideration culture/religion when developing sexual and gender-based violence programming? I attended one conference and one suggestion was to involve elders or faith leaders.
Yeah, absolutely. I mean, I think that that's a great suggestion. And and I think this is it's an important question, obviously for all different areas of intervention. I think that one thing that I've seen, and this again, I'm maybe a bit of a broken record. I feel like everything kind of comes back. I'm making everything come back to money. But you've only got so much time and so much resources, right? So we often have to choose who we're going to consult and who we're going to, listen to. And that's a difficult choice to make because everybody comes with their own perspectives, their own bias, their own definitions and understanding. And also, too, specifically always kind of going out and being like, well, I'm only going to talk to people who've experienced violence is not always feasible or safe. So I think the bigger question is to like when we're looking at how to take it into account, it's varied sources and triangulation of data, right? So, yes, talking to faith leaders, talking to community elders, vital. Talking to informal community leaders, I think is really important. A lot of times we have a tendency to go to the people who hold titles in a community, very important. But in some communities, there's people who are known, trusted, and respected, who have a lot of influence, who don't necessarily have a title. Um, Also, so I think that's important. And there's different like snowball techniques or sampling to try to get names and to understand, to look at existing research that's out there, and maybe put forward some alternative ideas and then bounce those off of folks. Working with other organizations, I think is also key. And that's where there is opportunities to share data and collaborate between actors. So you might not necessarily need to bring something in, but if you work with other actors who maybe have had, there's some contexts where there's only one faith, but in many places there's many, many faith leaders of many different faiths, right? So if you can work with a variety of folks or who have access to communities that you might not have access to then supplement that information and to add into that, I think that's what's key. And then, continuing to evolve and shift because again, how religion and culture is practiced versus how it's prescribed, it looks different. So I think it's about that kind of multiple sources, constantly evaluating, reevaluating, and looking for, like, assuming you don't have it all, assuming there's a gap, and looking for that validation and that check back with communities.
Absolutely. Thank you. Those thoughts are, I think, really important for all of us to keep in mind here. The thing I wanted to go back to is Kate did hope to see those questions that you
Yeah.
had posed.
I was just going to post them actually here in the chat.
Oh, wonderful.
That might be, yeah, that way I can still see you. Um, but yeah, and these are kind of things that I think I raised throughout, right? Is and kind of relate to the question that was asked, like how are we engaging people with lived and living experiences? How do we work together, kind of as Canadian and domestic actors? Um, I cited it before, but the obvious example that comes to my mind, right, is the work that has been done by Indigenous Canadian Indigenous communities to document and understand how violence is experienced in their communities, um, uh, even in direct opposition from the larger colonial structures, is remarkable. And has led to a wealth of understanding and information, and is a source of, I think, incredible learning, for people everywhere around the world, right? There's so much to learn and share. And so, how can there be, other opportunities to share and learn between countries, between nations, around who's doing what where, and, what initiatives that work well in some contexts that could then work well here. So that's something that, we spend a lot of time at CanWaCH on, is not just thinking globally, but thinking about, the opportunities for learning. Domestically and globally.
Even though I don't do the exact same work, I think that's something all of us can consider in how we research, how we work with communities, because I think those points are so translatable amongst different, I guess, spheres that work with sexual and gender-based violence. Thank you. Is there anyone else who would like to add in a question before we let Jessica enjoy her day? Not that this wasn't enjoyable either. Freedom on a Friday is
I
always
love
nice.
talking about stuff. So no, this is absolutely what I love talking about.
All right. Well, on behalf of both myself and Ava, thank you so much, Jessica. This was outstanding. I loved listening to you talk about your work and the work of your organization. And I'm sure I speak for everyone here that we're deeply grateful. See,
Yeah.
Fridays, that you took the time to share all this with us today.
I'm grateful that you invited me. Thank you again so much. And again, I invite folks to be in touch if they have any questions, if they'd like to know more about any of the work that we're doing at CanWaCH, or getting connected with any of our partners. We love to build those bridges and build those connections. So please reach out anytime.
Wonderful. Thank you so much, Jessica. Have a lovely day.
Same to you all. Thank you, everybody.